Hi, everyone, and welcome to Attentive Healthcare Solutions webinar, the PM reports you never knew you needed. My name is Chelsea Grover, and I'm the Marketing Communications Coordinator for Attentive. Before we dive into today's webinar, I'd like to take a moment to explain the process for the presentation. First, I'd like to mention that this webinar will be recorded. We'll send out a copy of the slides along with the recording within the next week. Next, for those of you who aren't familiar with Attentive, I wanted to share a bit of who we are with you. We specialize specifically in NextGen healthcare, and we're passionate about providing solutions for our healthcare provider partners, which in turn help them to improve patient care, enhance the patient experience, and maintain a financially healthy practice. To sum it up, we do everything NextGen. We also have some NextGen add-on productivity solutions, including ChartGuard and Refund Manager. Next, I wanted to mention that tomorrow we'll be doing a live demonstration of two powerful NextGen add-on products for NextGen, like I was just talking about. We're going to be covering the Unapplied and Deposit Manager and Refund Manager. Unapplied and Deposit Manager will save your staff time, whether they're working general unapplied amounts or using unapplied buckets to manage deposits. And Refund Manager streamlines and automates the process of finding credit balances on patient accounts and issuing refund checks. If you're interested in seeing a demo of how these products work and can make NextGen PM more efficient and automated, head over to the Events and Education page on our website to register for it, or drop a note in the webinar panel and I'll send you a link directly. Okay, so back to today's webinar on NextGen PM reports you never knew you needed. At the end of the presentation, we'll open the floor up to questions from you. We'll answer all the questions at the end, but you can type them in the questions area of the webinar control panel whenever they occur to you. Also, we will be going into some fairly specific reports in this webinar, so if your question pertains to something specifically, if you could mention what you're referencing in the question, that would be helpful since we'll answer them all at the end. And finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. And again, questions may be entered in the questions box. So without further delay, I'd like to introduce our presenters for today. Lindsay Lanning is Manager of Client Development, and Lexi DeMarsh is Manager of Consultant Development at Attentive Healthcare Solutions. So Lindsay, I think that you're going to start it off. Feel free to get started when you're ready.
Perfect. Well, thank you, Chelsea, and thank you everyone for joining us today to review the PM reports you never knew you needed. Now, whether you've been using NextGen for years or are brand new to the system, this webinar will help you understand how to use NextGen Practice Management reporting capabilities more efficiently and effectively. We're going to show you how by reviewing helpful PM reports, most practices aren't even aware of. This is possible really because we've been working with our clients over the years and we've come across a multitude of reports that we found, provide a greater insight into your practice operations and overall financial health. So we look forward to sharing those with you all today. Now, I'm sure this goes unsaid, but why we're presenting on this today is because of the crucial component PM reporting plays or should play in your practice operations and financial health. Running practice management reports on a regular basis is a key factor in maintaining a healthy revenue cycle. Reports provide practice oversight by identifying areas where you may unknowingly be losing income. And there are many types of reports, each providing a different lens through which to view your practice. So let me reiterate, there are a ton of reports you can choose from to keep an eye on how your practice is doing clinically and financially. Deciding which ones are best for your needs and then committing to incorporating them into your regular workflow is the key to success. Unfortunately, we found practices don't use all the reports their NextGen system offers. Physicians and office managers may not know about NextGen's, more sophisticated reporting capabilities, or they might not realize all the different ways you can use one report to gain different information based on filters and settings. Now, I did want to give a small disclaimer since there are a lot of you on today. When we wrote this description, we said, and I quote, whether you've been using NextGen for years or are brand new to the system, this webinar will help you. So to deliver on that promise effectively, we have 5 very brief introduction slides to the report filter window. So if you are a NextGen vet and have been using the system for years, please do not jump off since we have a ton of great information coming on reports. That's not, reporting 101, it's much more advanced. But again, we felt it necessary to make sure everyone's on the same page since we reference filters and settings on almost every slide and kind of lay the foundation to make sure no matter where you identify on the spectrum of experience you're seeing on the slide, you can walk away with valuable information. So like I said, if you are extremely familiar with these filters and settings, you get, 3 to 4 minutes to get settled and maybe answer a few emails before I turn it over to Lexi to jump into the more advanced reporting gems that we have. However, if you're a newer user, then this information is vital to understand what Lexi will be going over. Okay, so jumping in quickly to the basics of reporting in NextGen PM. Reports in NextGen PM have several configurable filter options displayed in that settings list on the left-hand side of that window. The tabs available are going to differ for each type of report. So depending on the report selected, these filter options are going to allow users to kind of overall select columns to be included on the report and control which order they display, specify a date or date range for the data on the report, filter in or out excluded data on the report, and then set parameters to define, how items are sorted, grouped, and totaled. So you can see, for instance, we're on the column setting in this screenshot. PM reports have default columns already selected to display on the report. Here they can be added or removed. They can be reordered using those blue arrows on the side. You can even modify the column names by right-clicking and typing in the name you want to see on the report. However, please note any changes to, even column positions or names are not going to be saved to the root report. These changes can only be saved if a report is memorized, which we'll touch on later. So you get the gist. Each tab in this settings list will offer you some level of control to manipulate the report you are generating. So the next two tabs we'll go over, I would say, are arguably the most important when setting your report parameters, and they're filter 1 and filter 2. And although similar in name, they're very different. So filter 1 tab on the report filter window is primarily used to define the date range by which data will be included on the report. Some other options found on filter 1 vary by the report you're running, encounter status, if it's an encounter or appointment type report, charge type, appointment status, include, exclude unapplied credits, etc., and can be used to include or exclude certain data accordingly. So I would say primarily filter 1 is going to have the date range and, any types of buckets or categories your report type may include to decide if you want a certain category excluded or included. So for example, if on an appointment listing report, the filter 1 appointment status is dropped down is configured to include only no-show status, only appointments marked as no-show will be returned on that report. Pretty straightforward. Now, filter 2 is completely different and always the more difficult tab to master, in my opinion. Filter 2 tab on this window basically allows you to define the data that will be included on each report. So each column listed can actually be filtered by between, equals or not equals, and greater than or less than, or even like. So again, I would say filter 2 is probably the tab that's maybe not used to its fullest potential the most often. I hope that makes sense, but essentially this tab is a gold mine for filtering data in a valuable way that many practices might not realize. But again, keeping it simple here, an example, if the self-pay balance column is set to greater than $100 on filter 2, only data that meets that criteria will be returned on the report, meaning, only patient balances greater than $100 will be included on that report. Simple enough. And this may be stating the obvious, but it always trips some people up when you're running a report. Keep in mind, data is only going to be returned on that report if it meets criteria on all the filters. So, if, for example, it meets the criteria on filter 1 and filter 2, but it doesn't meet the additional tab filters, it's not going to be included. Because as you can see, in addition to filter 1 and filter 2, there are additional filters available as tabs on the left-hand side of that report filter window. And those available options are going to be dependent upon the report. However, they all function in the same way. So one of these tabs, and the last one that I will touch on, like I said, in this very brief kind of foundation overview, almost done, one of these is going to be the sorting and grouping tab, or that sorting tab. So data returned on reports can be organized by sorting it in ascending or descending order, and it can also be grouped together. So grouping data, in different columns allow for subtotal calculations. And there are multiple sorting and grouping options available. This is done on this sorting tab on the report filter window, and it'll contain a list of all the available columns offered by the report. So this means that each column on the report can be sorted and grouped as desired. Again, the blue arrow icons are used to actually order the priority of the sorting and grouping, The order that the columns are arranged from top to bottom indicates in what order the data will be sorted or grouped. So an example, the appointment listing report can be sorted in ascending and then grouped by location as well as resource, and then sorted ascending by patient name. So if we click, we can see an example. I thought it would be important just to show what exactly this looks like on our report. You can see the top shows no grouping or sorting, and the bottom does. It sounds simple, but it can make a really big difference when you're viewing and analyzing these. Now, most PM reports are configured with default sorting and grouping, typically by provider and location. So the sorting tab should be reviewed and modifications made as desired prior to ever generating your report. So lastly, if you are not a reporting expert like Lexi, maybe you need a quick refresher on the report you're running. So NextGen, actually a few versions back, added an information button to the report filter screen on a number of commonly used reports. This will provide users, with pertinent information about the report without having to access any help button or other, documentation maybe from the success community. So if we clicked that info button, you would see that it would return essentially 4 sections of information. So first you have the logic, and it displays a brief explanation of, the logic for the selected report. You then have the filtering information, which provides information regarding the dates available on filter 1. Common uses will provide a list of different uses for the report, and then balances to the following will actually display a list of reports that balance to the report selected. So again, in my opinion, extremely helpful and useful for maybe even some of our seasoned reporting wizards on the line. But as promised, I will go ahead and turn it over to Lexi to get into the good stuff and what I'm sure you all logged on for. So Lexi, it is all yours. Take it away.
All right, thank you, Lindsay. So hello, everyone. I'm so glad that you were able to join us today to attend our webinar. So today my goal is just to kind of show you some practice management reports that either maybe you didn't know existed, or maybe you are familiar with the report, but now you may see it kind of in a different light. So there are so many ways that you can manipulate the data on reports in PM that really the possibility of uses for each report is almost endless. So I've chosen a few of our clients' favorites for a different category of reports. So these are the most, some of those underrated reports that we'll see in our PM application. So let's begin today by looking at some of our general reports. So the first general report that we're going to review is our BBP Schedule Report. So for any of the practices that utilize the BBP, you're probably aware that you actually have the ability to view, the schedule for your BBP by server. You can also see the history of, past jobs and packages, all directly within the BBP application. So while that can definitely be helpful to kind of see, a quick glance of your schedule and your jobs and things like that, in my experience, it can be really difficult to get a good overall picture of your BBP schedule within the application. So instead, I recommend that practices utilize this BBP schedule report in PM. So this report is going to allow you to see the schedule for all packages. You can sort this by, particular servers, and really this can help you to identify, any issues like overlapping jobs. So anyone who's worked with the BBP knows that, if you have any overlapping jobs, that can really cause the rest of your BBP schedule for that day to fall apart. So on this report, we can compare the run date. So, when that job or package actually ran, we can compare that to the schedule date, and that can help identify any issues. Also, if there's a lot of overlap in your jobs, or maybe not even enough room to add additional jobs that are needed, this report can also be used to identify the need for maybe additional BBP servers. So some of the recommended filters for this report would be to set that schedule date on the Filter 1 tab to whatever your needed time frame is. So for example, maybe you want to look at how that schedule ran for the past week. You can also group the report data by that package schedule date, and that's going to allow you to just kind of quickly look at your week schedule day by day. So I've included after every report that we're going to go over some screenshots of those recommended filters. So these are really just for your reference. So if you ever chose to set up these reports at a later date and time, you can come back and review these slides. And just as a note, these slides will be sent out to you at a later date, so you can always have these referred back to. So for my example here of the BBP Schedule Report, I used that Filter 1 tab to narrow down my results to a scheduled date of last week. And then I also grouped that data, as I mentioned, by that package schedule date on the sorting tab. And again, that's going to allow me to see that schedule day by day. So another possible use for the BBP Schedule Report is to identify when and why jobs are failing or skipping. So the report can include a column for our exit description. So if you're not familiar with what that is, that's basically just a brief explanation as to why that job didn't succeed. So this is going to be really important to help you kind of dig through, all of your jobs that are failing or skipping, and you can see what kind of errors you're experiencing. Like we saw with that previous BBP report, I'd really recommend narrowing down that schedule date so you can review the job results, maybe by a week or maybe look at it over a month. So you can set up that specific time frame that you need. And to only see the job results that you are concerned about, you can use that Filter 2 tab, and that's going to show you the results that you want to hone in on. So for example, if jobs are failing, if they're skipping, things like that. With those filters apply, I can quickly see jobs that failed. Like for example, in this sample report I have on the screen, I can see under that exit description column that these jobs failed because an instance of EPM was already running. Basically, that's just telling me that my jobs are overlapping. So I can look at that and I can go in and address that. So here on our filters screen, that again, these are just kind of for your reference. In this example for this report, I filtered that report to see the schedule date of last week. And then I used that job results filter that I'll find on the Filter 2 tab because I wanted to hone in on just see the jobs that had failed. So moving on from kind of our BBP reports, the next report that we're going to explore is a common one that you're probably pretty familiar with, and that's our patient demographics report. So this report, is commonly used to return a list of patients, and as the name implies, any of their demographic information. There are actually a few other kind of more unique uses that we have found for this report. So the first is to create a report. It's going to show you a list of patients who have not been seen at your practice over a period of time. So let's just say, for example, that you need to identify when a patient has not been seen in your office for over 3 years. So, at that point, if they're no longer considered established patients, so you want to be able to identify those. So you can actually set up this report to show you all patients that have not been seen in, my example of over 3 years. And then you can use that report to help you follow your practice's policy. Maybe, for example, you mark them as inactive in the system. So for this report, I recommend adding a column for last encounter date. Additionally, you can add columns for the last encounter number and location if you want to see that information for helping tracking that encounter. The Filter 1 tab is where you can narrow down the report to the amount of days since the patient's last encounter. So that's how we're going to get the patients within that time frame we need. So here are those reference slides for the filters. So as I mentioned, I selected a last encounter date under my columns. So that way I can see, the last time that they were in the office. And then really the key to this report is under that Filter 1 tab, that no encounter for however many days. So this is going to allow me to set the number of days that I'm looking for. So for this example, I used 1,906 days, and that's 1 day over 3 years. So another helpful way that we found to use this patient demographics report is to filter to find patients who are overdue to sign a privacy notice for your practice. So let's just say that it's your practice policy to require patients to sign that privacy notice yearly. So you can actually configure this report. It's going to show you the patients who are overdue to re-sign that notice. And at the same time, it's actually going to show you patients who were missed and never actually signed that notice in the first place. So in order to see this information, the first filter I'd recommend setting up is to include the privacy notice issue date and the privacy notice received date columns on the report. So, I recommend having both because just kind of depending on how your practice goes about, sending out and getting that signed notice back, those dates may be different. Then on that Filter To tab, you can select the privacy notice issued and privacy notice received checkboxes. For both of those fields, we're going to set our data to less than, and then you can select the latest date that should be on file for that privacy notice. So for example, if it's, again, like your practice's policy to collect that privacy notice every year, you can select the date that would be 1 year ago from today, if today's the day you're running it. So that's going to capture any expired privacy notice forms, so you can have those re-signed. And then that's also going to display any patients where that field is blank. So therefore, it's capturing both expired notices and missing notices for your practice. So again, here are those reference slides for this report. So I checked off both that privacy notice issue date and privacy notice received date columns. And then under Filter To, again, I chose that less than, and then the date, that should be the last date before the signed notice would expire. So in addition to catching those overdue privacy notices we just saw, that patient demographic report is also a great tool to determine when patients have missing demographics that need to be captured. So for example, let's say that your practice needs email addresses for patients to enroll them in the patient portal. So you can actually configure this report. It's going to show you all of those patients without an email address on file. So the first piece of configuration that I'd recommend would be to select the required demographics under the Columns tab. Next, under the Filter To tab, you can select that same demographic, so maybe email address in my example, or maybe a phone number, and you would choose equals blank. So when I do that, when I said equals blank, that's going to show me any patients that are missing that particular demographic. So again, here on our reference side, for this example, under that Columns tab, like I mentioned, I selected email address as my demographic that I'm trying to track and capture those that are missing. And then again, I went to Filter To, and I selected email address equals, and then I left that field blank. So again, that's going to show me all those patients that are missing email addresses, and also give me a column that as I'm working through my report, and I can refresh and I can see as those patients are falling off. So another great way that we've seen this patient demographic report used is to help solve an issue that I know a lot of practices really struggle with. So that is how to manage patients that turn 18 and are now considered their own guarantors. So this demographic report can actually be help you use to find patients that are 18 and older, but they still have that guarantor relationship of something other than self. So then we can actually work directly from this report and update that relationship as needed. So in order to display that patient's age, one of the first things that we're going to need to do is on that Columns tab, we're going to check off our patient age in years. Next, we are only interested in patients who are not marked as their own guarantors already in the system. So we can set that patient guarantor relation column to not equal self. And then finally, we only want to see patients who are 18 and older. So we can actually set that patient age in years to greater than 17. So this is one piece that can kind of throw off users when they're trying to think of how to set this report up. There's no typo, I did mean to say 17. We use greater than 17 because we also want to capture those patients that are 18 as well. Even if they're 18 in one day, we still want to make sure we capture them on this report. So again, we see here on our reference slide, in that first screenshot, our columns, I've added that patient age in years. And then I also filtered here for that patient guarantor relationship not equal to self. Because again, we're only interested in those patients who have a relationship of something other than self that maybe need corrected. And then finally, I set that patient age in years to again be greater than 17, and that's going to capture all of my patients 18 or older, with that relationship of something other than self. So as we just saw, there are so many ways that you can use that patient demographics report. So now let's look at another report under that general category that really is a multitude of uses. So that's our patient insurance report. So one of the ways this report can be beneficial is to kind of gain insight into the patient insurance distribution in your practice. So this can be used to kind of identify some of those most common insurances used on encounters for your patients. So one of kind of the unique ways I saw that this report used by one of our practices is they needed to make a really time-consuming change to every payer in their system. So hopefully, you guys haven't experienced this yet, but if you have, that can be really overwhelming. So they actually used this report to identify which payers that are kind of most beneficial to start with. They did that based on the payers most frequently seen at their offices. So they know those payers are going to have the greatest impact, so they started with those. So some of the recommended filters here, that first column that would typically be used for this insurance distribution report, kind of an obvious one, but it's that payer name. You also can include, a column such as like the person number, for example, and that's going to give you a patient identifier on that report if you did want to use that to kind of do any follow-up tracking. You also can kind of optionally include that encounter COB column, like I did here in my example, and that would just give you some more details, like that breakdown of, insurances, are they primary, secondary, tertiary, things like that. On that filter one tab, you can also filter that report by encounter date for whatever necessary time frame you want to look at. So, maybe you want to look over the past few months, or maybe, a year as a whole. You can also select our active only filter. And so that's going to allow us to only see current insurances. And then finally, it's recommended on that totals tab to check off that count records box. And that's just going to allow you to see how we can see here kind of quickly at the bottom of each payer, the total number of patients with that individual insurance. So here's that reference slide. So again, in this example, I checked off that person number field because I wanted a patient identifier. I have my encounter COB column as well. Under filter one, I selected my encounter date of the current year because I wanted to see year to date what my insurance distribution looks like. Again, under that same tab, I selected active only to see only my current insurances. And then on that totals tab, I checked off count records. So I wanted to see the totals for each payer as well. So another way that patient insurance report can be applied to your practice is to find patient insurance records that are missing a scanned insurance card. So as I'm sure you guys have probably encountered along the way, that scanned insurance card can really be an important tool, if you're trying to verify or maybe make corrections for billing or even eligibility, things like that. So this report can help identify those gaps, if maybe scanning that card was missed for a patient. So to identify which patient insurance records are missing that scan card, I recommend adding the columns for both the front insurance card and the back insurance card image. Active only should probably also be selected on the filter one tab, because obviously we're only wanting to focus on those current insurances. And then we can also narrow down this report to only those patients that are actually missing that scanned insurance card, obviously what we're looking for. We can do that on the filter two tab by setting up the front insurance card and back insurance card fields, both to equals blank. So here on this reference slide, for that missing and scanned insurance card report, you can see I added my columns for both that front of card scanned indicator and back of card scanned indicator. Under filter 1, you can see I set that to active only. So again, we're only worried about those active insurances. And then under filter 2, you can see front insurance card and back insurance card. I've set both to equals blank. So again, we're trying to find those patients who are missing that scan card. So then the final general report type that we're going to look at is the patient recall plan report. So if your practice does use recall plans, this report is kind of typically used to identify patients that are currently enrolled in recall plans. But even beyond just identifying the patients, this report can actually also be used to see how effective that recall plan really is for your practice. So this report can be configured to determine, are patients actually scheduling an appointment after receiving that recall notification. So you can see here in my sample report, I can quickly see that these patients on this list, they are past that expected return date, but they have not scheduled or kept their appointment because their recall plan is still active. So for my filter 1 tab, I would select that expected return date column, and I can use that to kind of narrow down the dates of my report. So I can set for whatever time frame. So maybe if you want to review these over the past month or even the past few months, you can do that. There are also a few options for my active filter also on that filter 1 tab. It's just going to kind of depend on the information that you need to see. So one way we can do it is if we want to only see plans that the patients had failed to schedule an appointment for, we can choose active only. The other option is if we want to see all of our recall plans and we want to determine, when patients have scheduled an appointment, and so that recall plan was then auto-stopped, or if it was manually stopped for whatever reason, we can select active to include all. So that's going to show us both active and inactive recall plans. And then on our filter 2 tab, you can set either that first letter sent date or that first electronic notification sent date to not equals blank. So the method that you use to send your recall plan notifications is going to kind of determine which you select. So if you use paper letters or those electronic notifications, you'll choose one of those fields. And we want to set it to not equals blank because we only want to see data on our report where the patient actually received that recall notification in the first place and therefore had the chance to then follow on that and schedule their appointment. So here's the reference slide for that report that we were just going over. So this is going to allow me to see, again, patients who didn't schedule an appointment or maybe didn't keep your appointment, just kind of depending on how you have your recall plan set up. So on that filter 1 tab, I can see that I set that expected return date to last month. So, I just want to go back over the previous month and kind of see how patients scheduled appointments. And then I also set that active plans to only. So again, that's only going to show me plans that are still currently active. So if a patient, had made that appointment or had kept that appointment and it, automatically stopped that recall plan, I won't see it on my report. And then to see, only plans where a recall letter was actually sent on that filter 2 tab, again, under that either first letter date or first electronic date, I would select not equal, and then I would leave my date field blank. So another use for that patient recall report is to bulk stop plans for groups of patients. So this feature can be helpful, a lot of different situations. Maybe a provider left a practice. So you obviously don't want to be sending, notifications to those patients saying, schedule an appointment with this provider. Or, maybe you need to stop your recall plans for any of your expired patients. I know in some of the later versions, they've added in some, things to automatically stop those recall plans, but if you're not on that version, or, if you expired them before you upgraded, this report can be really helpful for that reason. So the reason that you're stopping the recall plan for this group of patients is really going to determine the exact filters that are needed. So, in that example I was just giving, let's say we want to find for all of our deceased patients that are still have active recall plans and we want to stop them. We can accomplish that by going to that Filter 1 tab, and we would set that expired patients filter to only. So again, this is showing me all of the patients with active recall plans that are expired in the system. Another option is, let's say that you have a location that is no longer open. So again, we don't want to send recall plans, telling patients and scheduling for that location. So we can actually go in and select that location on the Locations tab, and then we'll see all the plans associated with that location. Another option is that if you want to filter the report for any recalls with a specific resource. So again, back to that example, maybe you have a provider that's no longer with the practice. So, you want to stop the recall plans for that particular provider. So again, you can do that by selecting that resource on the Resources tab, and it will show you only those plans. So once you've chosen, the appropriate filters, depending on what you're looking for, you would actually run the report. And then on this recall plan report, you would select that Stop Recall Plan button. So that's automatically going to stop that recall plan for all the patients returned on that report. So it can save you a lot of time and cleanup. So on this reference slide, you can see here some sample filters for, again, those 3 examples. So, my expired patients, a location that's maybe, no longer open, and then a provider that maybe is no longer with your practice. Okay, so as you can see, there's plenty of ways to take those reports under that general category and really mold them into what your practice needs. So now let's take a look at a few of the reports under the Accounts Receivable category and how you can really use them to your benefit. So the first Accounts Receivable report that we're going to look at is our Billed Encounters report. So we kind of typically see this report used to maybe review your billed encounters, and you can see data such as the charge amount, encounter age, things like that. But beyond the ability just to review the encounters, this report can also be configured to show the lag time. So between when the encounter date was and the first time that encounter was actually billed. So that gap in time can be pretty important for your practice to analyze. Maybe after some digging, you find out that your providers are not submitting their charges in a timely manner from the EHR. Or maybe those charges are not being manually entered or processed as quickly as you would like. So, as we well know, the longer those encounters wait to be billed, the longer you're delayed in receiving payment. So there are a few recommended filters to see that lag time for billed encounters. So the first is to add that bill date, that first bill date under columns. So that's really what's going to allow you to compare the first date it was billed versus the actual date of the encounter. Next, we can set that encounter date range to whatever you need under Filter 1. And then on the Sorting tab, you have a few options for how you can group these encounters. So you can group by location name, so how I did in this example. If you want to group by provider, or even encounter date, however you want to view that information. Okay, so here you can see on this reference slide, again, some of those sample filters. So like I mentioned, I added that first bill date under our columns tab. I filtered my encounter date, so I chose last month. So, if I want to do this on a monthly basis. And then finally, I chose to group, as I mentioned, those list of encounters by location on that sorting tab. So that's going to allow me to view all of those encounters for the past month by location. So the next AR report is maybe one that your practice is not familiar with. I know that collections process and dealing with insurances, it can be a really long and tedious process. It might require multiple calls and, a lot of following up, and that can be difficult to keep track of. So this is a report I always recommend, and that's going to help you with that process by creating kind of what we call a collections work list. So that work list is actually created from users flagging encounters with a future follow-up date. So that happens on our encounter maintenance window on the billing and collections tab. So the users will actually mark that encounter for follow-up, and then they can add encounter notes with any details, like you normally would during your follow-up process. So once those encounters have been marked for follow-up, you can actually run this report periodically, and that's going to give users kind of a reminder to complete the follow-up actions that are noted in those encounter notes. One of the nice things that if the collections process is actually complete for that encounter, they can go ahead and go into that encounter maintenance window and uncheck that follow-up date box, and then the encounter is going to fall off the report. However, if additional follow-up is still needed, they can update that follow-up date, and again, those encounter notes, and then that encounter will show back up again on this report when that date comes. So it's pretty simple from this report to, again, like I said, review those encounter notes or maybe make any changes, on the encounter maintenance window. So to do that, users can actually just double click, on any of the encounters listed here on the report, and it's going to open up that patient's chart directly to the encounters tab. So when setting up the filters for this report, the first item I always recommend is to determine what follow-up date range you would like to see. So, we can use kind of whatever date range, if we want to say for today, if this is something, you plan on running on a daily basis, you can set it for a full week, if you want to see kind of a longer list. It's just really up to, your users and your workflow. I also always recommend sorting this report. So you can group your encounters, by some examples of like a follow-up date or maybe by the encounter date. So then that way users can work those encounters, either by maybe the ones that need followed up on first, or maybe you'd rather have them work the oldest encounter date, just again, depending on your practice's workflow, how you want to set this up. So before we get to that reference side of the filters, I did just kind of want to quickly show you this follow-up date section on that encounter maintenance window, billing and collections tab that I just mentioned. So just in case you're not familiar with this field and you weren't really following what I was saying, this is the field that I was mentioning. So you can see that users can enter that follow-up date. So, when they need to, take, additional action on this account. And then you can also see there in the middle of the window, there is an encounter notes section. So it's kind of nice all from one place. They can see, any previous notes, maybe what was discussed previously or what needs to be done. And then while they're going through their follow-up process, they can add new encounter notes here as well. So finally, as promised here, that reference slide. So again, I set this up under filter 1. So I did a follow-up date of the current week. So I'm choosing to look at this, at a week time. And then I also, under that sorting tab, I grouped by that follow-up date. So, I chose to do that so that way I can work those encounters, by the date that they were assigned for follow-up to be added to the work list. So the next section of reports that we're going to take a look at today are our scheduling reports, but probably not in the way you're thinking or used to seeing them. So when we typically think of scheduling reports, we're used to looking at, obviously as the name implies, our schedule. So the appointments that we have coming up for that day, maybe using it to look back historically when patients canceled or if they no-showed. But there is another report under this category that can sometimes be overlooked, but I think it's really important, for that financial health of your practice. So that report is our kept appointments with no charges. So you can actually use this report to go in and ensure that all of your appointments that were checked in or marked as kept have charges associated with them. So if they don't, then they will show up on this report. If your practice manually enters charges or maybe you choose to manually process your EHR charges, this report can be really crucial to ensure that those charges aren't missed. Because if your charges aren't entered in a timely manner or at all, it's going to be pretty difficult to get reimbursed for those services quickly. So one thing I did want to point out for this report is that this will include appointments that were checked in if any users are using that appointment kept checkbox on the appointment. So when they check that off, there's not necessarily an encounter attached. So if there's no encounter, there's most likely no charges associated. But it's still going to be on this report, and maybe it's something that you need to go in and kind of clean up as you're going through this report. So one of the first pieces that I recommend in filters to set up for this report is to choose for that appointment date range that you want to see on the Filter 1 tab. So, for example, maybe you want to do this on a weekly basis or for the past month to kind of go in and kind of clean up. Next, I'd recommend on that Totals tab that you check off that Count Records checkbox. So that's going to allow you to see, as we can see here, the total number of appointments that are missing charges. And we can see that, depending on how you're grouping them by like location or provider. So you can see kind of an overall view as well. So again, for your reference, here you can see in my sample, I filtered this report by that appointment date for, let's say, like the last month. So again, I want to go back to the past month and do some kind of cleanup. And then under that totals, I checked off that count records box. So again, that's going to show me totals for all of my locations for missing charges. So our next category of reports is our daily reports. So these daily reports, they can really help you dig into all things financial for your practice. So you can review details by encounter, or get even more granular if you want to look by line item. So let's look at a few ways that you can actually use this data to your benefit. So one of the first daily reports that we're going to look at is our encounter listing report. So, here we can use this report to see a whole host of data for your encounters. You can really get very specific. But one of the ways that, a lot of our practices like to use this is to configure this report to track copay collection. And specifically, we're looking to see copays that were collected on the date of service. So you can break this down to look by location or just the practice as a whole. So, as copay collection can be a step of that check-in process that can be difficult to ensure it happens. So, you can add it as part of your workflow, which a lot of practices do. But, if the users forget to set that active batch, they're not even going to see that screen pop up during the check-in process. Additionally, maybe your users are remembering to collect the copay, but they're collecting the wrong amount. For example, let's say if they should be collecting, a specialty copay versus an office copay, but they're not really aware of the difference. So we can use this report to kind of see where there's additional areas where maybe additional training would be required for users that are supposed to be collecting that copay. So to view that copay that was intended to be collected, versus what was actually collected, you can add the encounter copay amount column and also the patient paid amount on date of service column. Then on that Filter 1 tab, you can kind of narrow down this report and typically recommend by encounter date. And then finally, we want to weed out any encounters where a copay was not required, because obviously we're not worried about those. So we can set that counter and copay field amount to equal $0. Excuse me, not equal $0. We only want to see those where a copay was required. So I did want to point out that this encounter copay amount field that we're utilizing actually pulls from the encounter insurance maintenance window, that field that I have in red here. So if your practice doesn't use this copay field, then this report isn't going to be as helpful because you won't have both columns, but you could still use that patient paid amount on date of service to see copays, if they were paid for that particular encounter. If you do choose to configure this report for your practice, and here are these the different filters for reference. So again, that patient paid amount on date of service column. You can choose that encounter date range, maybe you want to look over the past month, and then that encounter copay amount not equals $0. So another daily report that can help you gain some more insight into how that money, is kind of flowing in your practice is a line item report for payments. So this can actually be set up to help you track the turnaround time for when a payment is received from individual payers. So, you can kind of see, there's some issue, with getting those payments, or, if you need to tweak your practice's workflow for processing those payments. The columns that you need to see on this report is going to depend on your practice's policies. So first, I would always recommend that you add that first bill date column, and that's going to show you when that line item was actually first billed out. And then to see when that payment was received, depending on your practice, you may need to use the process date, the transaction date, or maybe even that post date column. And next, I would filter that report by the process date of the needed time frame. So again, you can look over a month or maybe even a year range. And then on filter 2, you want to set that source type to third party. So we're only interested in seeing, payment lag time from our insurances. And then finally on the sorting tab, you can choose to group those payments, maybe by the payer, and that's going to allow you to see, any issues with individual payers. So again, here we can see in our sample, that first bill date column was added, and then I selected a process date of last month. So additionally, I use filter 2 to show only the line items with that source type of third party. And then finally, I grouped my report by payer name. So in addition to our daily reporting category that we just explored, we also have our monthly reports. So that kind of allows you to see that financial data for your practice at a higher level. So a report that has become one of our clients' really favorite for viewing that big picture is the extended amounts and transactions report. So this is under that service item summary category, and that can be configured to show net collections for charges over a period of time. So this is done by showing, those total charges, payments, adjustments, and any refunds. So, it can help you really see, how effective your collections process is overall. So you can run this periodically and maybe even identify changes, with how, your collection is happening. So to see those net collections, the first piece that I always recommend is that you would add that balance amount column. So that column is going to show you any of the charges minus our adjustments and payments, plus any refunds. So essentially, that net collection. On the filter 1 tab, I recommend that you sort that report by the charge process date that you need. I recommend using this over the charge create date. So, if there is kind of any lag on charges and, your practice does override the process date, it'll be more accurate. And then that sorting tab can be used to group the data by financial class, or you can even use, payer, just kind of depending on your needs. And then finally, I recommend checking off that total lines only, because, we only are interested in seeing the net collections. So really that line item detail isn't necessary. So again, we have our reference slide. And so you can see in my example here, if you did want to set up this net collections report. Again, you can see here I sorted by that payer name, and then I checked off my account records. So the final report type that we're going to explore contains probably some of the most overlooked reports in the PM application. So I really find that a lot of practices are either unaware these reports even exist, or maybe they know what they are, but they're not really running them on a consistent basis. So our data maintenance reports or system reports, they help you find any discrepancies with your data in your system that could potentially cause issues in other areas. So it can help you find and even in some case correct the issues, and it might even before you are aware they exist. So for this reason, I strongly recommend that you run these on a periodic basis. I did want to mention that there is, these reports are database intensive. As imagine it's sifting through your entire system. So it is recommended that these are run after hours. So for this reason, I think these are a great candidate to set up for our BBP reporting. So we'll go over that in a second. So the first system report that we're going to look at is our charge validation report. So one of the common reasons this charge validation report needs to be run is to correct a line item out of balance error. So if your user is starting to see this error, this report can quickly locate that line item that's causing issues by comparing that financial tab on the chart to balance control. Once the issue is identified, this report can even be used to automatically correct the error. And it does that by moving the line item balance to the patient amount bucket in balance control directly from the report. So here you can see an example of an encounter where that balance control, you can see it's showing us a balance of $10, but that financial tab is showing a $0 balance. So again, to correct this, I could double click on that line item and the system will automatically correct that error. The next system report that we're going to look at is the history, non-history status report. So before we get into the details of how this report looks, I did just want to point out that in versions prior to 591.841, these are actually two separate reports. You can still run them individually. You can still kind of go through the steps we're going to talk about. The main difference is you can't autocorrect errors in those previous versions, so you just have to manually correct them. And usually that happens in balance control. But our history, non-history status report is going to show us encounters that are either in history status or non-history status in error. So you actually have the ability to correct most of the errors on this report automatically from the system. So, for example, one of the big issues that you might come across is, let's say you have an offsetting, credit and debit on different line items for an encounter. So you can actually use this report to automatically correct that error. I did want to point out that this report is ready to go out of the box with one exception. That offsetting credit and debit feature I just mentioned, it would require you to set up a transaction code. So again, this slide is just for your reference. If you did ever want to set up this transaction code, you can set this up in file maintenance, and then you would apply it in your practice preferences under that transaction code section. So here you can see an example of that history, non-history status report. So it's showing me some errors that I uncovered from running this report. So I could usually fix these by double clicking on the row to autocorrect it. Or if not, I can always right click on a row and it will get me into balance control, and then I can manually fix that issue. Another great tool under the system reports is our miscellaneous data maintenance report. This report is kind of like a catch-all for any of those errors in your system that are not corrected on our other system reports. So some of the errors found on this report can be corrected automatically, so just running the report will actually fix them. But if there are any errors that couldn't be corrected, I'll see that in a notification, and then I can actually export the report, and I can send that to my technical support, and they can help me fix that on the back end. So because this one can actually automatically correct errors, I really recommend that this one's run on a daily basis. I should say a consistent basis, not necessarily daily. So you can see here, this is an example of that miscellaneous data maintenance report. So this notification is letting me know that no errors were automatically corrected during this run, but I can see, however, that there are 2 errors that need corrected manually. So again, I could export this report and send it to technical support for their assistance. So as you can see, we just covered a large number of reports that hopefully your practice can kind of tweak and customize to your needs. I know we're getting very close to the end of time, so I promise one last section. If you do have the ability to stay on, if not, the recording and the slide deck will be sent out. So one last item that we really recommend use the most of these reports we're just mentioning is to automate your PM reporting. So one of the first ways you can do that is to memorize your reports. So this is a feature that you may or may not be familiar with, but it just allows you to all those great filters we were just talking about. You can save those, and then you can even set certain security, who's allowed to run, modify or save that memorized report. Once you've gone ahead and memorized those favorite reports, you are ready to use the next feature that we're going to discuss. So that feature is our BBP, or our background business processor. So I kind of touched on this a little bit earlier, but if you are not using this currently for reporting, this can be a really great tool to let you set up the reports that you typically need to run. Maybe like your month-end reports, or again, those data maintenance reports that we recommend running periodically. You can just set them up once and then kind of forget about them, and they run for you. And they can be, emailed to you. They can be printed automatically. They can be saved to a folder on the network, saved as a snapshot. There's so many different options, and you can just kind of set it up once, and then you can just kind of forget about it, and it will, be emailed to you automatically or printed or whatever you choose. So I wanted to end with a little food for thought. So a quote that I really like is, automation is to your time what compounding interest is to your money. So, we're all about, saving you guys time, down the line, saving you guys money. So hopefully that throughout this webinar, you maybe discovered some new reports you weren't aware of, or, maybe an old report that you've been using, you're kind of seeing in a new light. So sorry about running a little bit over, but thank you for joining today. I'm going to turn it over to Lindsay now to discuss our next steps.
Yeah, thank you, Lexi, for all that information. A lot of good stuff. I know, we ran a little bit over on time, but the recording and slides will be sent out. And hopefully, if you can stay on, we can answer some of your questions here. So, if you are interested in learning more about this, or you're not sure what your next step should be, you can let us help. We can assess your current practice state. We can provide recommendations and help implement new processes or procedures. So if you want to go ahead and flip to the next step slide for me, Lexi. Go ahead and jump one more. I want you to feel free to visit our website that you see on the screen here. You can continue to sign up for our webinars and consider some of the services that we offer, such as our on-site 3-day fixed price on-site consultations. Those focus on clinical workflow, more importantly and more pertinent for this webinar, the revenue cycle and front office, as well as technology and performance. And as always, test drive our products. And as always, feel free to reach out to Lexi or myself directly. We have our contact information up on the screen for you if you do feel like you need assistance. But besides that, I will turn over to Chelsea at this point to take us through any questions that might have come in during the presentation, which it looks like there are a good amount.
Awesome. Thank you so much, ladies. Okay, first question. What is BBP?
And I know I maybe jumped into that without explaining. So yeah, I explained a little at the end, but yeah, it's the background business processor. So you can set it up. It can actually automate a lot of your processes. Specifically, I touched on here reporting. So like I said, it can automatically run those reports for you, but it can also do things like, automatically bill your encounters, create claims. There's a lot of great features for it. Yeah, if you are still on the line, and if you have more questions about it, you can definitely reach out and I can give you more information.
Okay. Can you run demographics report to show clients seen in the last 3 months instead of not seen? I think that Cindy actually answered this one. Cindy, do you want to jump on and restate that? Nope. Okay.
Yeah, sorry, I just had to unmute. Yes, that's fine. All you have to do is select different filters.
Perfect. Can you also run?
I actually think Lexi covered it in a later
okay.
part of the presentation.
And the other question was, can you also run reports to identify expired insurance?
Yes, and Lexi, I think, addressed that one as well. And you might also want to look at some of the encounter reports, depending upon what type of information you're going for.
Thank you, Cindy. Next question. Do you recommend doing the miscellaneous report through BBP each night?
So I think I might have said daily. Daily is probably a little bit of overkill. That kind of came out of my mouth. What I meant to say was periodically. I would say every night that's probably a little much, but I mean, probably, once a month is sufficient just because it is database intensive. But as I mentioned, you can set that to run on the BBP and just kind of set it up and forget about it. But I would say probably monthly is sufficient.
Okay, and it looks like we only have one more question. So if you have questions, we'll stay on to answer them. Looks like we got more coming in. It looks like somebody's having issues with they're not seeing filters for options on their NextGen report servers and no information options on the report servers. Would that be a possibly a version problem or an access problem? What do you think that might be, Lexi?
Possibly, yeah. If you're not seeing any of the filter tabs at all, my guess, usually if you can't see anything at all, my first assumption is some kind of access issue. Yeah, because you should definitely be able to, and even if running from the report server, you should still have the same filter options that you would from the practice management application. So maybe you're, going to your, system administrator and just kind of verifying your access. That'd be my advice.
Perfect, thank you. Next question. Do you recommend, no, we did that one. Am I able to set up BBP if I follow the instructions on the slides presented?
I hope so. So yeah, I kind of just gave kind of a generic, way of setting up that BBP specifically for those memorized reports. If that person still is on the line, if you do have issues, you can always reach out. But yeah, it's pretty straightforward how to set those up, and I know there's good success community guides as well. But yeah, that's kind of just a sample of how to set that up that I gave in the slides.
Yeah, I also think one thing I'd like to add is that the BBP, depending upon the size of your organization and the security in place within your organization from your IT, there's different ranges of clients. So sometimes you might have to have some access to utilize that as well.
Thank you, Cindy. Next question. Can you run reports for patients that are due for cervical cancer or pap smear?
That is a great question. I would need to look specifically at, kind of some of the filters for that. So I will go ahead and if we have your information, I can follow up on that one specifically.
Yeah, I can actually address some of those as well. I mean, there are reports, but a lot's going to depend on what you have done. As regards if it's a certain type of PAP follow-up, maybe you could search on the procedure and look at the date range. If you're setting up recalls for them, that could work. You could also look, from a PAP smear perspective. Those are typically annually based on carrier, so those are probably a little easier than the cervical cancer one. Only from the standpoint, it would a lot depend on what mechanisms you have set in place in your application today. So that's probably not a one-size-fits-all, but Lexi will certainly get back to you with some options.
Perfect. Next question. If we need help setting up reports, can we call to get assistance? Sometimes I find it a little confusing.
That would be, we're happy to be able to set up something. I mean, it depends on, we have direct customers, we have clients who have consulting arrangements with us. We don't have a problem in answering a quick question, but if it's looking for some training or something, we're really happy to, reach out to you, talk to you about some of our services to let you do that, but we're happy to answer a quick question.
And speaking of questions, I think that's it. But obviously you see Lexi's and Lindsay's information up on the screen. You can feel free to reach out to them directly, or you can always reply back to my email. I'll be sending out an email with the link to the slides and recording within the next week. So basically any way that you can get a hold of us, feel free to reach out to us and hopefully we can help you out. Lexi, Lindsay, Cindy, thank you all for joining us today, and thank you everybody for attending. I hope you have a great rest of your week.
Thank you, everybody.
Thank you.
Thank you.